Hi, so we're with Frankie and she's in today for a spay. She's 7 months old, but she's actually got a few other issues we have to address today. We noticed when she came in for her puppy vaccinations that she actually had an umbilical hernia, and this can be a common problem that we do see. Technically it is a fault, so you shouldn't really breed from them. The other thing that she's got is these dew claws, and they're actually loose. So if they were attached, we're not allowed to remove them, but I can actually feel the bone there, but it's actually loose, there's no connection. So that's what we call non-articulated. So we're allowed to take those out. If they're articulated, then it is legal to remove them. So she's okay, she's actually got a similar one on this side as well. So we'll be removing that one. And just when I was examining her for her anaesthetic today, we noticed that she had some extra teeth. And I haven't ever seen anything quite like this before. I have seen a similar one in a cat. And you do often have the retained baby fang teeth, which is quite common. But this is actually a retained molar. So once we have a bit more of a look, you can work out this carnassial tooth is a big 3-rooted tooth. It's sitting more lateral outside of the face, and it would normally be in line with these others. And the reason is it's actually being pushed out by this baby molar here. So this one's actually loose, so you can tell that that's the one that needs to come out. And oddly enough, she's got the same thing happening on this other side of her face. So this will be a developmental problem. That one's not quite so loose, but I'm sure we'll be able to get that one out as well. And then she'll end up with her normal teeth that she should have. I've just rang the owner to get consent that we can do this extra job on the teeth. And she did say she meant to mention to the nurse on admission to check her teeth because the dog was having some issues chewing some food occasionally. So that was a good find, and just part of a general health check and pre-anaesthetic. Always look in the mouth. So we will get on and get her fixed up, and we might see you later. Thanks for watching. Just tidied up those flaps. I might pop a wee stitch in that one on the left. So we've finished Frankie now, and she's just waking up. So here's our incision from our spay, and I just went a little bit further up and corrected that hernia. Her dew claws, they were pretty straightforward. There's always a little bleeder at the top end, so you go grab that, ligate it off, and then you can put your little stitches in. And then what we do is generally just a small bandage just for 24-48 hours, as long as the dog will tolerate it. And we've just shown you the teeth. So here's our everything here. So there's our wee dew claws have come off. There is actually bones in there, but the connection isn't there. There's a wee gap in the bones, so that's what I was meaning about articulated. So they were quite loose. So they were removed. There's our wee hernia. So just a wee bulge of fat. Honestly, it was just a 2mm wee hole that had popped through, obviously from birth. And there's our wee teeth. So that one was still attached in there. A few roots, but we got them out all as one. And that was the one that we saw that was loose. Yeah, so very interesting. Often when you book in a spay, you don't always know if there's other things. It can be quite hard to allow enough time to do everything, but it's a good opportunity while they're out to look at teeth, look for hernias, all those sorts of things. So she'll be waking up soon. Thanks for watching.